are excited to have with us Dr. Marie Huggins, who is an outpatient therapist with Cressman Counseling, PLLC. She is a licensed clinical mental health counselor associate in North Carolina and holds a PhD in counselor education and supervision from the University of North Carolina at Charlotte, as well as a master's of education in counselor education and supervision with a concentration in college counseling and student development in higher education, and a bachelor's in applied psychology and Africana studies minor from North Carolina State University. She also holds the credentials of a national certified counselor and a global career development facilitator. She currently works as an outpatient therapist at Cressman Counseling, servicing clients in Durham, North Carolina, and surrounding areas in North Carolina. And we are excited to have her with us today. Just a quick note before she gets started. Again, we are recording the session. The recording will be made available to you. Dr. Huggins is going to be sharing the slides with you as well. So please engage with her. You have an expert at your disposal, so ask those questions. I will be monitoring the chat box for her, but we are excited to have her. So without further ado, I will pass it over to Dr. Huggins.
Yeah, thank you so much, Nafia, for the warm welcome. I appreciate it so much. And I'm going to get right into the presentation, and I appreciate you for monitoring the chat, but I'll get right into the material in terms of motivational interviewing. So yeah, we'll dive right in. Let's see, I'm going to hit that and we'll share this. Hopefully everyone can see my screen right now. Make this a little bit bigger for us so we can have it in the presentation. Yeah, so the title of the presentation today, just in general, is motivational interviewing. And let's see, so we can, there we go. So Nafia did an excellent job with my introduction and just in terms of like who I am as a clinician, but more so even too, my work with MI is woven through all of my experiences and my expertise. So yeah, that's just, I won't go through all again, but that's who I am. So hopefully we can connect after this. I'm open to sharing my contact information. Let's see. So as we dive into the presentation, I want to be transparent about the acknowledgements in terms of where all this excellent information came from, and in terms of those who've developed this and created it over time. And so we have the work of William R. Miller, Stephen Rolnick, and Teresa Moyer. So initially, MI was created to help treat clients who were struggling with chronic alcohol use. It really was influenced by some of the earlier psychology theories. It's humanism, as well as the Transtheoretical model of behavioral change. So prior to that time, a lot of therapy was very confrontational. It was very moral based, and you're not doing good, you're bad. And this is a way for us to kind of get away from that moral model and really figure out human behaviors and be more empathetic and understanding to clients. So yeah. So I should talk a little bit more so about just the concept of humanism and like what that means. I'm going to move this here so you guys can see a little bit better. So it's a concept that's been developed by Carl Rogers. And so within that, it's in order for a client to grow and change, a therapist or a case manager or whoever it is must create an environment of growth by embodying 3 attributes. So congruence, right? So we do that within our day-to-day life. So that's just that whole being genuine, being real, showing up as our true self, right? 2 is going to be unconditional positive regard. And so we have that within relationships, with friendships. That's just going to be you having that acceptance and compassion for those. Even though you yourself may not be going through what they're going through, you're still able to give that to them, to accept what's happening, to be compassionate. And 3, empathy, which goes along with the first 2 that I mentioned, but just more so being understanding and really recognizing what that individual is experiencing. So that's basically the foundation of the concept of humanism and what it means to really help clients grow. These are great attributes to have within an environment of therapy or within human services or case management. So now we want to work to define MI. So now that we know that humanism is the base within that, motivational interviewing more so is a collaborative, goal-oriented style of communication. And we're really going to be paying close attention to the language of change. And we'll get more into that in terms of like the spirit of MI and change talk. But right now, it really is a language that you're adopting, and it's designed to strengthen like personal motivation and more so like adherence to the specific goal or even a lifestyle or anything like that. So it really digs deeper in what that person's reason is for change, where we're going to have that acceptance and compassion that we talked about prior in terms of humanism. So ultimately, to keep in mind in brief, MI helps create clients develop these intrinsic motivation to change. So when I say intrinsic, that's what's happening inside in terms of like, your inside, your thoughts, your emotions, and that's impacting obviously your behaviors. So that's it in short. But wait, so before we talk more about MI, it's helpful to first talk about how people change to the transtheoretical stages of change. So we scratched on MI, but this model will be helpful to you all as you're working with different clients within the cases that you see in terms of gauging where they're at and ultimately being able to assess the readiness for change. So this is the transtheoretical model of change. It's from Procasta and Clemente. And again, initially, this model was used oftentimes with those who were preparing to abstain from substance use or maybe working towards recovery, but it's been helpful in applying it to other types of behaviors, such as like readiness for work or making a life decision, a change. So I'm going to go through each step with you in brief to kind of give you an overview on how you could work with this. So the first stage is pre-contemplation. Within that, we've all seen clients who've been like, there's no problem, things are going just fine, really in that state of denial. They're really unaware of their behavior as being, negative or countering what their goals are at that time. May meet with some resistance when you do ask that question. And oftentimes, as a result, they may start to feel very hopeless. So that's like the first stage. And I know we've all seen someone, we've been in that stage ourselves. So even thinking back to a time when you felt that, I don't see a problem, there's no problem. Contemplation is the next step. So that at that point, you're aware of the problem. Maybe at that point, the client's saying to you, now, this has been bothering me. But at the same time, I'm not quite sure why, right? Or they may even start to think of some ideas of how to change. Well, I needed employment, so maybe I should start looking to see what type of positions are out there. But then you may ask them a question and be like, are you thinking about applying? And they may say, no, not yet. I'm just thinking about it. Ambivalence is a term that we'll expand more on deeper in the presentation, but that's really just more a concept of being in the middle. So they're not quite yes, and they're not quite no. And we'll kind of go a little deeper on that in a bit. As you progress in this model, preparation is the next stage in terms of really having now a detailed plan established. They may articulate that to you and say it within a session or talk with you about it. Some I've been known to like write it out. Look, these are the things I want to accomplish. These are my goals. They may be very vocal in announcing their intention to change. I just told my boyfriend about this. I talked to my girlfriends and friends, or my mom knows all about this, or I talked to my child, or they may be really announcement based at that point, or they may say, I told myself. And that's still in a sense an announcement, because for them saying it out loud, that's going to be important. At that point, they are set to take action and motivation is happening. And they're feeling that. So they're getting ready for the next stage, which makes sense. This is action, right? So there's that visible action. Those plans that they've articulated and even wrote out or thought out are now actually moving, right? So they're actually going online, applying for a position. You see that they're having interviews, and maybe a change starts to happen in terms of them taking themselves a little bit more seriously, or maybe them being more focused. It really is a shift in the thinking and self-image. You may see confidence boost at that time. They may be more introspective and say, you know what, on that interview, I could have done that a little bit better, or next time around, I'm going to do this. At that point, they're really just doing it, whatever it is they're setting forth to do. And maintenance is that ongoing effort and commitment. So that point, they've obtained their goal, but more so too, it becomes a lifestyle for them and they're living it. And that consolidate change is now a habit. So yeah, they're at that point. One level I didn't include, but it's something for all you all to keep in mind, is the idea of a relapse. And so at that point, the individual could potentially go backwards. And that's very normal within this stages of change, it could happen, but more so too, they can also move within like different stages. And so that's okay, it's very normal. So just a quick summary of the stages of change we went over. It is a process of change. So with process, that means it's ongoing, and it can occur all the time. So it's, even though you may say, oh, they look like they could be at pre-contemplation, but they start to grow and show signs of the thing further along, or then they're not fully in it yet. So, and the thing to keep in mind too, many people can change without help. And I think it's more so like an intrinsic thing. Like they may say, I need to do this. And then also, it really does serve to emphasize positive reasons for change with individuals. And it can require more motivation in the earlier stages, as we saw, dealing with things such as denial or that ambivalence. At that point, the individual really will have to do some inside work and figure out the reason for change. So this in itself is not MI, but when combined with MI, it helps people decide on their own plan of action. So it's a great pairing within this. So I think this chart will be helpful for you all. So now we're going to dive into an introduction of motivational interviewing. So now we'll get even more specific into what MI is. I know we scratched the surface just a bit, so now we'll get a little deeper. So I thought to start this presentation, this portion of this, with a little comic. I know this is like dating me and everyone at whatever, but Beetle Bailey, you may remember the comic, but he's going up to lead a motivational seminar, and he says, do what I say or else. And then he says, you can't get more motivating than that. So he leaves the podium. And I know that it makes me laugh because I think about this, and within that, he's giving a command. And he says, at that point, I'm leading you to the water. You should know what to do. And ultimately, this is very problematic, but oftentimes people will think that this in itself is motivating. And we'll talk a little bit more how this could be problematic, even though he has their best interest in mind, I'm sure. But I'll start this out. So you would think that having a heart attack would be enough to persuade a man to quit smoking, change his diet, exercise more, to take his medication, that hangovers, damaged relationships, an auto crash, or even memory blackouts would be enough to convince a woman to stop drinking, or losing one's life savings and child's inheritance in slot machines would be enough to help a man to quit gambling. So these are extreme situations where it seems like a change needs to happen in terms of their wellness, for them to live a full life. And yet so often it's not enough for people to change. So the question I'll pose to you all, just to think of as a hypothetical here, is just, what is the key for client change? Yeah, so with all that being said, it's client motivation. And I know we may say, oh my goodness, I don't really see that. Or maybe I could see that, but it really is within MI the key for clients to make a change in terms of their life. And the reason why is that there's just been some successful treatment outcomes and predicted by, in terms of that being intrinsic with the client. So, if they're motivated internally, they are more motivated, they're excited, they want to do it. Also treatment attendance, so the person adhering to whatever they need to be going to, and also compliance. And so more so, in short, the more motivated the client is, the better they'll do in terms of their outcomes. So you can see this picture here. It's like the others in the image are kind of confused or not quite sure. They may not feel as motivated, but the one who maybe has more intrinsic motivation and knows what they are motivated to do, they may have more focus and able to really see their task to the end. So it's greatly influenced by the service provider. So I don't want to say that it's just the client on its own. And that's when MI comes in, because as a service provider, there's things that you can do to aid this process while the client is working on that internal motivation. So the client's motivation, retention, and outcome vary. With the service provider for who they're assigned, we understand that. But the style in which the service provider or counselor, that really drives the client's either resistance, and for that, confrontation can drive up and empathetic listening can bring it down. So it's, the service provider is a big determinant or factor in terms of the client's motivation. And that's where we'll get in more so into MI style and the delivery and things that you can take on and bring into sessions and meetings with clients to really aid within that. So again, just in a more like we're really fleshing it out more, but MI in short is that going to be a directive, client-centered counseling style for enhancing that intrinsic motivation and change by exploring and resolving the ambivalence. And early on, we mentioned what ambivalence meant a little bit, but just in short, it means two. And I'll move this down a bit, but you can see here within it, you know, the client at that time is not sure about those two options. We know ambivalence means two. So they say, I'm ambivalent about this album. It's both bad and good. So it's basically like it's saying a lack of clarity. We're working to gain clarity with our client. And you can see the picture inside really hones into the concept of intrinsic motivation. So I had some examples before, but that's going to be an engaging in behavior that's personally rewarding, not for an external reward, which can be challenging. So you see her, it's not the straight A on the paper, but it's more so that idea that she has inside about something maybe she would like to pursue. And with something being client-centered, it's really focused on their intrinsic needs and more so too on you understanding the client and them feeling a safe space to do so. So they're so interconnected. And I think this little and brief definition works to break it down really well. So we'll move on. So some sources for motivation. So we think about external pressure, you know, and that's reality for all of us. So things that could be such as deadlines, it could be, you know, there could be monetary pressure, you know, it could be like livelihood, it could be your needs to need to be met in terms of like, I guess, housing or place to stay, but more so too, now we're going to add that with the internal motivation, which is like that, what we talked about before, a very intrinsic thing. So in short, externally motivated subjects had long-term outcomes only when they had high levels of internal motivation. So in other words, like those who had external like factors such as money or, you know, maybe it was status or prestige, it helps, but they also needed to have high levels of internal motivation to aid with that. So it's something to keep in mind when we're working with our clients. You may say, yeah, I really want to make a lot of money, or I really want to have a secure job, but then honing in too in terms of what internally is driving them to have that external item. Like, is it, you know, is it because it'll provide safety, having that conversation. So I just wanted to break that down a bit. So I also want to break down 10 things that MI is not. So MI is definitely not a way of tricking people into doing what you want them to do. So it's not, you're not under any type of mind control with MI. You're not, you know, forcing someone to do something. It really more so is a specific technique. It's a counseling method. So no specific technique is essential within MI. It really is like a toolbox for you to use, and there's things you can pull from it at different times. It's definitely also not a cure-all for every clinical challenge. I think that there are a lot of other modalities out there that you can utilize. I think we talked oftentimes about humanism and person-centered work, which is basically the underpinnings of MI, which is helpful to use on its own too. And it's not strictly, I should say, the Transtheoretical model of change. While it's helpful to know where your client is at stage-wise, that in itself it's not fully MI, that's a part of it. And then Rogerian or client-centered therapy, MI brings in components of that, but MI by itself is not that type of therapy. MI is also not cognitive behavioral therapy. And it's not all about a decisional balance where you're trying to decide of like pros and cons. It's not assessment feedback where you're having them take a survey and you're getting the results. It's also not easy to learn, but I will say that the tools that come with it make it very helpful. And so I think once there's a mastery of how it can be done, it can feel very easy. And it's practice as usual. I will say that it's a muscle. And so I think as you all have this presentation today, you'll have some tools and you can find ways to bring it into your practice too. So some of the effectiveness of motivational interviewing, so I pulled from SAMHSA, and so it has an overall rating of 3.9 out of 4.0 on SAMHSA's National Report of Evidence-Based Reports. And anything that's evidence-based is going to be more empirically sound, and it has more research behind it. And then also the AMA endorses the use of MI to promote health-related outcomes. So that's really helpful in terms of like people who need to be taking their medication, adhering to doctor's appointments. So these are really good that these bodies of work are saying, wait a minute, this is reputable and it's going to be helpful in practice. So it's also effective for, like I said, disease management, lifestyle changes, such as like those who want to work on their physical fitness and activity, addiction and substance use, like I mentioned, overall, couples counseling as well within the criminal justice system, of course, and then changing any undesired behavior. So I want to break down in terms of the continuum of styles with MI. So it really falls right in the middle with more so the solution-focused therapy, which is based on, obviously, like it sounds, finding solutions for our clients that we see. And it's more so under the guiding lens. Directing would be more so kind of behavior therapy, cognitive behavioral, reality therapy. And I mentioned Dr. Phil, who's been known to do a lot of like confrontational statements, such as like, how's that working for you? Or is it, just very direct with clients, which can be intimidating. And it kind of goes against the constructs of MI, which is really working to rolling with the resistance and being as a guide, where the others are mentioned are more of like a following style. So now we'll get into the spirit of motivational interviewing. And this quote I thought was helpful in terms of really breaking down the foundation of it. So it says, people are usually better persuaded by the reasons which they have themselves discovered than by those which have come into the minds of others. And that's by Blaise Pascal, who was a 17th century philosopher and academic. But the crux of that quote really hones in on that intrinsic motivation, or that intrinsic idea that client's idea of things can really help and guide in terms of what they see for themselves going forward, versus you saying, this is really what I think you should do. And it's not to say you can't suggest, but ultimately what they see for themselves is going to be important. So within MI Spirit, we'll focus back in on that, is the acronym CAPE, and this will be easy for you all to remember, but it stands for compassion, acceptance, partnership, and evocation. And so we'll break down each one of them in ways you can incorporate that into your practice. So the MI Spirit, the C within that, the CAPE, the compassion. So compassion is a deliberate commitment to pursue the welfare and best interest of others. We've heard that term obviously used within our day-to-day, and you should exude compassion, be compassionate. That person needs compassion. It's really the focus on, like I mentioned, giving priority to the other's needs and actively promoting the other's welfare. And I know within case management, within counseling, or these type of human services, we really are prioritizing that client's needs. It's very need-based work. And within that, the welfare of that client is being upheld to things within their best interest. And that quote here, I can kind of move this so you guys can see it, but compassion is the wish to see others free from suffering. And that's from the Dalai Lama. So I think within that too, we're working to alleviate a lot of the suffering. There may be systemic racism issues that you're dealing with outside of what's happening within your time with that the client's going through. And so showing them that ounce of compassion within already a lot that's going on with COVID, within, the stressors of life, it really hones in on making them feel validated and heard within their session. An example of this that you can incorporate within your sessions is, as your counselor, I'm in this for your best interest, not my own. And I think too, that focuses back on lending some of that power back to the client, who may feel as though, well, the person I'm meeting with is in a position of power, but no, really, I do hold a stake at the wheel. I can be driving this too. And with that statement, it's giving a little back to the client. It can also help with letting them know that they can be responsible in this process too, and their interests are important. So the next one within CAPE is acceptance. So again, acceptance is a word that we use in terms of just someone being seen, like I mentioned here, with their absolute worth as being honored as a human being. And also really supporting that autonomy for them within MI is going to be important. They should be able to have agency. And within that too, making decisions on their own for his or own way. And basically, that's through that accurate empathy to understand their perspective. And it's definitely going to work to affirm the person's strengths and efforts. So with that acceptance, you are seeing the whole client, and there may be things that they do need to work on, but within that time too, there's a level of understanding that's happening between the counselor and the client. So here's an example for you to incorporate. So, and you could change the wording around to how you feel fit, but I'm invested in understanding what it's like to walk in your shoes, or I accept where you're at in this process right now. And within that too, that's saying, you know what, so you've maybe explained to me what your life's journey been up to this point, or maybe some struggles that you've been experiencing, but you're willing to hear them out for where they're at right now in order to better understand the steps going forward with them in terms of their goals and aspirations. So acceptance is definitely something that you can incorporate within a statement, within an intake, as you follow up with them to check in to see how things are going, to reiterate the acceptance of them. Partnership. So that's that P within CAPE with MI Spirit. So with MI, it's a big saying that we utilize. It's going to be dancing as opposed to wrestling. And I bet you all can imagine like why it's dancing and not wrestling. And oftentimes too, I know that even with clients I've had in the past who may have been mandated or didn't want to be there, early on, it might feel like you literally are wrestling them, or maybe they're saying something that's just inappropriate and they're upset and they're angry and you want to just get in the ring with them. But in reality, that's going to cause more tension. And we all know that, like, why did I jump in on that? And I should have, had some self control, and worked on that, and we're all guilty. So with the dancing, the metaphor, it really helps to illustrate the gentle moving with them in terms of that ambivalence they may be having. So back to that ambivalence, the client may say, well, I know I need to get a job, or, I know that I feel the need of that, but at the same time, I don't know what to do. And with the confrontational, that was like, you just need to do it. Get online, look at jobs, go to these job fairs, get it going right now. That's maybe more of a wrestling stance. And they may hear that and get, whoa, like, I will do this and da 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 da. And then it can go back and forth. But with that gentle dancing, you're able to really kind of roll with them and get them to expand maybe more and really dig deeper in that ambivalence they've been expressing. So a partnership example with that would be, I bring case manager expertise, but you are the expert in your story. And ways to change. We can collaborate on effective strategies and ways to accomplish your goals. And I think that's an excellent time for a case manager to be able to look through, maybe there's some treatment goals or things that have within the program that they need to accomplish. And they can also, chime in with their comments, say, how does this align with, what you see for yourself? Being that you're the expert or you know yourself best, are these things that you feel like you can do? And if so, I'm willing to work with you as a support, as a guide, and let's talk about these things together. That's more of a partnership. You can bring a little to the table and they can bring some to the table. So that could be an example of that. So then the last part of CAPE is that evocation, so the E. So this is more of a strength-based premise rather than that deficit-focused model. So within the strength-based model, we're really honing in on their strengths. Maybe they've communicated effectively with you, or maybe they've been on time a lot and you've appreciated that. Very like transparent in their sharing, rather than looking at them from a, well, you did mention that you were struggling with this and this and this and this and that, and that's going to be a big problem and we can't do that. And it's not to say we don't want to highlight that, but in terms of the strengths of that, we do want to showcase and show what they're doing well and what could be improved on even more. So people who have already taken this with themselves, it's much needed. They need to it needs to be evoked. It needs to be brought out. And a client's own arguments for change are going to be more persuasive than whatever you as the clinician suggest. So really working to pull that out of that client to really evoke that change based on their strengths rather than that deficit is going to help with this part in the conversation. So a statement within that could be look like for you to use, you have what you need and together we will find it. My job is to bring you to mind reasons for change from you. So in other words, we're really going to be pulling out like what's already there. Having a conversation and say, what are some ways that you could apply yourself to this? And within that, that's working to evoke that change talk and also to get them with that mindset to change. So now we're going to, again, pull out more with ambivalence. So this is in short, I want to change, but I don't want to change. And we've all been there. I think we can even think back to something that we've wanted to work on and change with ourselves, right? Whether some people are, I need to get up earlier, or maybe I need to go to bed at a set time, but something keeps getting in the way. More so ambivalence is those mixed feelings. They can even be contradictory thoughts about something to the point where you don't know which way to lean or go to one another. And so the thing to keep in mind with our clients, so we can show them some grace, is very few decisions in life are made with 100% certainty. There are those who are extra decisive, and I tip my hat to them, but for most people, they're kind of, what should I do? I've got to think this through. I'm not quite sure. And so ambivalence is very normal. And it's a part of that change process for everyone. I brought out the example of losing weight. Is this a little example, or someone working on their fitness maybe? But some of the negative thoughts and feelings that I've heard from clients, just anecdotally in the chair, is I'm too tired, it's too difficult, I won't succeed. But when asked, deeper on, like what are some reasons or thoughts or feelings if you did, or if you work towards that, some of their responses were, I do want to be healthy. And I want to be able to hike that mountain. I want to feel better about my body. So those are going to be the thoughts and feelings that we're working off of in terms of really checking in and with that ambivalence, because now we have another side to the coin. And so that will give us some more clarity. So when they're caught in between it for too long, like I mentioned below, the individual can remain stagnant. And with that stagnation, they may feel as though it can be crippling. They can't quite get out of it. And we'll talk about, I guess, more so ways to point out these discrepancies so we can move out of that ambivalence in MI. So now we'll move into the 4 principles of motivational interviewing. So the 4 principles of MI are founded on just 4 basic principles. And within that, you're going to be expressing empathy, like we talked on a little bit before, and also developing discrepancy. And that's how we'll really work to move out of the ambivalence that we talked on a little bit earlier. Rolling with resistance is another thing that we're talking about. I know we said we're moving away from wrestling, and we're now going to be doing more of a dance with our clients. And then a big one too that hones in on the strength-based approach is just supporting self-efficacy and the concept of self-efficacy in terms of self-worth, self-value, pride in self, and just the belief that they can accomplish the things that they want to accomplish. And I want to pause and see if there's any questions going on. I see, okay, great, some questions. I just wanted to check in, some things are going good. And, but the first principle is with you expressing empathy. And early on, even before we talked a little bit about MI, we talked about those humanism principles and how it's just basically a human right for us to be met with one of acceptance. It's a critical and crucial attitude within MI at this point. So that's going to be the use of that reflective listening. It's fundamental to the client feeling understood and cared about. And again, within this, we know that ambivalence is normal, and the service provider should demonstrate the understanding of the client's perspective, and labeling is unnecessary. I know it's tempting sometimes to be like, you're doing this, you're doing that. And that oftentimes too can feel a little boxy, and clients may feel like they're being kind of pigeonholed or like put in a box. So with that point, we're going to stay away from labeling if we could. So okay, developing discrepancy. So this is a big one. So we talked about clients experiencing ambivalence, but more so even within that too, don't really know which direction to go. And so we could see with the chart I made about losing weight with those negative thoughts or the doom and gloom. And then the other side that talked about the hope and what they saw for themselves, this is the time where we can work to develop discrepancy. So you want to clarify the important goals for the client. Maybe the client has outlined what those goals are and say, I know you're wanting to work on A, B, C, and D. Then you're going to explore the consequences or even the potential consequences of the client's current behavior. So talking to the client and saying, I know you mentioned to me that it was really important that you, work to, find effective childcare. Being the case that, you're running, maybe the individual that's providing care is going to be winding down with their time for that. If that case, that could be nerve-wracking, not knowing where your little one's going to go. And so then the thought of thinking, well, where would they go? And so then it's like, that may impact your work schedule. So that's a consequence if we don't really narrow down and look into what some childcare resources could be. Then at that point, we're really going to create and amplify that discrepancy between their current behavior and their life goals. So this cartoon's a little morbid, but it said, what fits your schedule better, exercising 1 hour a day or being dead 24 hours a day? So obviously I don't recommend saying that exactly. This is an extreme, but more so in saying to them, hey, like, if you don't do something now, do you want the latter? And we can obviously do that in a more gentle way, but this is a good way to get the ball rolling and thinking how they were putting out, like, if you don't do this, or I'm noticing this, and let's see, I'll show. So it's the gap that we're highlighting and wanting to focus in on. So for clients to recognize the gap. So when I say is not what I do is really what the crux of this is. So things which are important to them. So here's some examples: being a good parent, spouse, having a job, finishing school. Those are things that they've said, I really want to have that in my life, or I see that as a goal. And then from there, their current behaviors or choices are not supporting that goal. Maybe the client shared that with you. I really don't talk to my partner. I don't really talk to my spouse. I'm not applying for jobs at all. I don't really do that at all. And I don't really need to study. It's not important to me. Like, who does that? Like, I know I'm in school, but no one really studies. But like I said, I do want to finish school though. So in your head, you're probably going, what's going on here? Right? So this is the behaviors that's the gap, right? It's honing in on the gap that's happening. So the change happens when the participant recognizes the gap between the present behavior and what she or he wants. So this is a key technique in pointing out the discrepancies within MI. And I just want to go back within that real quick to kind of focus in, but a statement that you could utilize to really hone in on this gap would be like, I know you've expressed how important it is for you to finish school, but on one hand, you mentioned to me that you haven't been in studying or, doing your assignments. And how do you feel about that? Has that been hard for you lately? Or that doesn't align with what you told me? Or you could even say, I'd love to understand, or, to see what's going on with that goal that you mentioned and what's happening right now. And that way you're figuring out and letting them see the gap too, because very well there's clients I've seen, they get said both things and they may not see it. And so that could be a way of gently bringing it to light within a session. Principle 3 is a rolling with the resistance. So we want to avoid arguing against the resistance. If we see it happening, we want to stop, because at that point, the arguing leads to confrontation. And it can shift the perceptions for the client, and they may feel as though they're being confronted and kind of placed in a corner. We want to invite, but not to impose new perspectives, and saying things, could I offer a suggestion to you about something? Or do you mind if I, give my take on this or what I think is going on? And that way you're inviting yourself in versus on, let me just tell you what you need to do, or this is what you need to be hearing. Because again, that may sound very imposing, but you're inviting yourself. And also value the client as a resource for finding their solutions to their problems. Simple questions of, has this happened to you in the past? And if so, how did you get out of it? Thinking of it right now, what are some ways we can work to resolve it? And say, where would you start with this? Again, they have a lot of their solutions, but oftentimes they can be clouded with the stress of whatever it is. So asking that to break it down bit by bit can be a bit more helpful. So now we're going to be focusing on supporting self-efficacy. So with all this change talk and things needing to be intrinsic and you to work towards that motivation, the belief in the ability to change is going to be so important for these clients. So it's such an important motivator. We can probably think back to even ourselves and saying, I really want to accomplish this, but I don't believe in myself, or I have doubts, or I'm unsure, and I just don't feel as though I can quite get there. That's impacting ultimately your motivation for it. You may feel discouraged or may feel as though, oh my goodness, I don't know where to begin. But again, the client is responsible, just want to reiterate, for choosing and carrying out the personal change. So within that, that's coming from them. So for them to embody hope, there's a range of alternative approaches available. I think kind of assessing self-efficacy, asking a simple question: do you believe that you can accomplish this? Or what are some of the things getting in the way of you getting this going forward? Or you showcased to me that you've done this before. Those are going to be ways of motivating them too, externally a little bit, but also having a reminder that they can motivate themselves too. So let's see. So now we're going to get to more of the main methods of the MI process. So we've gone through the spirit and the principles, but now we're going to more so some tools that you'll be able to utilize even outside of the ones we've just explored. So within this are going to be your goals, and that's going to be within the time with the client. You're going to work to establish a connection, a good working relationship between you and the client and therapist. That's going to be more so that rapport building. That could be done through your intake time, within the time you have a conversation with them on the phone. This is my first time talking to you. Tell me a little bit about yourself in brief. I really want to get to know you a bit. I'm doing this and this in this department. That can help with trust, familiarity, and comfort, and also really helps to orientate you to the client's concerns, and also it can orient to your role. Like, what exactly do you do as my case manager? Well, within this role, we work on this and this and this, and this is what I do. So they're not like, I don't know what that lady does. I talk with her every so often, but I have no clue. It just helps to clear the air. Those techniques you can work on are the rapport building, like I mentioned, the empathetic listening, ORS, which I'll get more into, which is a technique within MI. So with rapport building, that's very self-explanatory, but clarifying roles and setting boundaries. This also could be a time as the case manager, it says, you know what, I do this and the third, but I also don't do that. Oftentimes too, clients will assume, and then the case manager or therapist gets put on a lot more tasks than are required of them, and that can also lead to role strain. And also having a conversational assessment style, finding out goals and priorities, and just continuing with the active and empathetic listening. So empathetic listening, ORS, I'd highly recommend utilizing this tool if that's something new to you, and maybe you feel like you're doing it, but you want some more structure. Those open-ended questions, those are going to be really great instead of maybe the closed-ended questions. So what emotions are you experiencing right now? Or how are you feeling down today? It's more open-ended. You can give a more meaningful thought response back the client can, versus like the yes or no, like, why didn't you come? Like, we won't close. I could think of an example, but with affirmations, that's going to be key within ORS in terms of just verbalizing the support, or that makes sense, or things like, I hear you, or I understand it's a difficult situation for you. That's giving an affirmation. It could be something like, wow, you did an excellent job. You put in for 4 positions today, or you were on time at work, or you're really working on creating a savings account for yourself. Like, that in itself is affirming a behavior, but it's also showing that you're listening and retaining to what they're saying. Reflecting skills, mirroring what the client is saying, it can show collaboration. Reflection stems, I'll get into that a little bit. And summaries, maybe the clients talked for a bit. You saying, well, it sounds like during your time away, you did this, this, and that. And from that, it sounds like you sound even more motivated. But I could also understand how you felt a little sad about not hearing back from that employer you wanted to hear from. And oftentimes too, that could lead for them to say, you know what, I have been. And the conversation continues to be flushed out. And it's not that yes, no exchange because you're giving them room to talk. And so now we're going to work to convert some closed questions to open questions. So this is always like a fun thing to do, I think, just to get our brains going. But a closed question is, do you think you have a problem with your anger at work, right? So that's your like yes or no, right? The way you could rephrase that is, what concerns your anger at work? And now we get more in terms of the descriptive of what those are, in terms of what's broaching that anger. What problems has your anger caused you? Anything else? No. The client may kind of say no, nothing else. Whether he could say that is what else? And that's just a simple word change, right? Is it important for you to keep your job? Yeah, of course it is, duh. They might even get a little like reactive, I'll say. But more so, how important is it for you to keep your job? Then you get to list out too, like what are some things that are important for them, their job, and may align with goals, things they want to have within their life. Don't you have anyone who can watch your kids? That's been said. I've heard it said. I mean, it's a thing when inquiring about childcare. What options do you have for childcare? These questions, as we convert them, do you also see how there's more genuineness to them? They are more flexible, less boxy, they're more open, and these are going to warrant more open responses from the client versus the closed or yes or no. It could be more reactive and even more confrontational. So some ORs, those affirmations, I kind of gave some examples, but thanks for coming today. That's honoring them and making that appointment, right? So that's really important. I'll move this over a little bit. And I appreciate you're willing to talk to me about your substance use. It could be anything, about your unemployment, about your sadness, about your frustration with the job market. You're obviously a resourceful person to have coped with these difficulties. I think that one's a huge one given this current climate. People have had tons of loss as relates to COVID or just life changes. So that's a good one of just honoring them being really resilient. That's a good idea, and feeling validated in what they've said and you saying that. It's hard to talk about, but I really appreciate you keeping on this. And that honors that it could be difficult, but you say, you know what, you're sticking with it. And for that, I commend you. So some qualities of good affirmation. So it's not cheerleading, you don't want to be in there just saying, yeah, you're going to win in everything. Like, this is perfect. Everything you do is great, because that can feel very like blind a little bit, like just kind of you just doing it for doing it and a little like misplaced. So they're sincere, specific, and immediate. And they do focus on specific things about the participant rather than broad or vague statements. So obviously what I used was, going to be used in context with something that was shared by the client. You want to be honest and genuine and not phony. And so it can help build rapport, reduce participant demoralization, and feeling like I'm doing bad if I don't do what I need to do, but maybe they did something around what they needed to be doing, and you can still give them an affirmation for trying. And it helps with that self-esteem and that self-efficacy that we're working to build for their motivation. Reflections. And so I thought this quote was so great, but it says, without reflections, we go blindly on our way, creating more unintended consequences and failing to achieve anything useful. So reflections are key in terms of us looking and getting that back and seeing that, and allowing for us to kind of pause and see what, it's a different view, right? So this is going to be the part where you're restating information to the client has said to you back to them. It shows you're listening, it checks your understanding and what they're saying, and also helps to know that you're on the same page. It's an easy way to also decrease the numbers of questions you ask when working with participants, because it's offering a lot of clarification and replacing those questions of like, wait a minute, what are you saying? This, is that what you mean? Or this? But we'll show you some examples. So here you go. So the communication cycle is more so what the speaker says, what the listener hears, what the listener interprets, and more so what the speaker means. So within that too, this is just the way we take in information. We're interpreting the information to get a meaning behind it. So it really is breaking down the flow in which we communicate. But the interference happens when right in between here in terms of what the speaker means and what the listener interprets. So oftentimes too, you might hear something, but at the same time, or how you're interpreting that, it can get a little jumbled. It's like, you're not quite understanding. So that's where reflective listening helps to bridge this gap, literally, in terms of what the speaker means and what the listener interprets. So these are some ways to help with that. So simply repeating what was said, right? So if you don't understand, can you please repeat what you said? Rephrasing, slightly reword, but not add anything new. And then paraphrasing, so that's the infer that unspoken content to make a hypothesis. And then there's a complex reflection of feeling, that makes you happy, you feel glad, like you can do that within that. Those two at the bottom are a little more complex, but I think simple ways can be just as effective and still evoke meaning and things like that. So summaries are just a longer form of reflection. They can be more so highlighting the reasons for change. It's a confidence in being able to change, and then the values and goals and intrinsic motivation. It helps both of you stay on track. I think as a listener, if you're hearing a lot from the participant or the client, you could say, wait, I want to pause right there. I'm hearing that you are working on this and that and the third. And for you, that's important because that's something that you want to work to change. So here's a summary structure that might be helpful for you. So it starts out with, begin by indicating what you want to understand. So for instance, you could start by saying, let me see if I understand what you've told me so far. That's a very simple statement to start that summary process. Then you'll work to focus on the participant's change talk. If the feelings are mixed, that's when you can think to summarize the pros and cons. And so you can also think to end with the pros and talk in favor of the change as a little nudge. That can be more helpful too. People will have those things where they just say, what do you want, the good news first or the bad news? But when we want to do the cons first and the pros later. So that will help with that. So then finish with a key question. Where does that leave you? Or what do you think you want to do? Or what else makes it important for you? So that's a way of starting, a summary structure or phrasing a summary. I do want to hone into on the reflection stems. As you're about to start a reflection, if a client just said something, it sounds like, okay, so you're saying that from your point of view, you believe, your fear is, it seems that it's important for you and you feel as though. Those are all going to be ways that you could start out reflections based on what the client has said. So focusing, now we're going to be really targeting these specific changes, what the client's priorities are. We want to develop a conversation about the change. So that can be done through agenda mapping, giving information, and you can do a patient dilemma too, but I think the first two are more helpful. Agenda mapping, just like we have here, it could be on a blank piece of paper. We're literally brainstorming topics to address. I put one bubble in, you have 4 circles. What's the main thing we want to be focusing on during our time here today? Job seeking. What else out of job seeking do we need to look on? Resume writing. Okay, we also need to figure out, how much time we're designating for that. So scheduling. It's a way for you to narrow down priorities. And then what you could also do is have a finalized agenda with rank in terms of what's public enemy number 1, second bullet, third bullet, and things like that. Or maybe it's just one for right now. Maybe they're just needing to take it a little bit at a time. That can be done too, but agenda mapping definitely helps with that. Giving information. So we want to reiterate that the client is the expert on themselves. And yes, you're getting to know them and you're learning the ins and outs of them, but you also just want to ask permission to share information. And within that, you could say, you know what? I've got some really good information on using LinkedIn or like using this platform. Would you be interested in learning a little bit more about that? And they may say, I'm not sure. And can I come back to it? Sure. That's your way of offering that exchange, like asking for permission. You want to tie information to the identified client concern, or you could say even, I have some great information. that I really would think that it's going to address you having the concerns you mentioned about your job searching process right now. I think it would apply directly to that. They then may be even more inclined because we got more specific. So ask the most helpful way to share. Some people are big on pictures, some like numbers, some like charts, some like lists. Whatever it is, we all learn differently. And so it may be a video that they watch or something from YouTube or another platform. And then just say, like, you could also do the ask, tell, ask, like, well, ask me something, I'll tell you something, and you ask me something, and that can help with the conversation too. And you also just want to check in to see, is this working for you? Or do you understand this right now? Is this too much information? Just to make sure you're not putting too much on them. With evoking, again, this point, we're really bringing that out of them. And we really are just kind of preparing the supports and resources. The ways we do this are those questions, the hypotheticals, pros and con tables, a readiness ruler, change talk, and responding to change talk. Let's see. So those hypotheticals or extremes are great things to ask. So suppose you continue on without making a change. How do you think your life might look in 5 years? This is an excellent one, especially for someone who hasn't thought long-term or is very afraid to think long-term. It's a good way to do some planning with them. If you could magically change one thing right now with snapping your fingers, what would it be? That way you get this reality for them it can come to fruition by them actually telling you what it is. Some clients may be creative and want to draw what it is, but another thing too, what's the worst thing that could happen? If you do make this change, what's the best possible outcome if you make this change? That's a good way to really dig deeper. The pros and cons table is going to be an excellent resource. It's so simple. We've done that before, but with NMI, it really is helpful in terms of addressing the changing behavior and the advantages and the cons of not changing. And here are just some examples of different ways that you can do that. What concerns you about not making a change? What about your current situation do you not want to continue or to get worse, right? Or how can you see you're improving your situation if you were to make this change? So this type of dialogue in itself, having the client take a minute to write it, you looking at that, reviewing it with them, going over things, or having them go away and have come almost like a homework and bringing that listing back. It allows for them some time to really work on that and weigh out some things in a constructive way. And also the readiness ruler. This is going to be a great way to gauge readiness for change. Asking a question to a client and saying, on a scale of 1 to 10, 10 is being like you really see yourself putting in for that position today. Where would you be at? Well, I'm at an 8 or a 7. Well, then say to them, I'd really like for you to pick one number. Okay, I'm at an 8. Well, that's good. That's high on the readiness for change. Why did you pick an 8 and not a 7? And that's a conversation. And then assessing the confidence. So you set an 8. Where's your confidence level in for putting in for that job? Well, I'm at a 6. Well, why did you say a 6 and not a 5? Well, I said that because I need to work on my resume and it's not ready. If I had my resume ready, I'd feel like I was at a 7. We really deconstructed where their motivation was to make the change in their confidence and also the importance of it for them in their life right now. So this person's ready to do the application, or they feel they want to, but they're not so confident because they're lacking in their resume. So this is a great thing I'd incorporate. Readiness level. This week, even take it back to the Transtheoretical model, right? So we can see with the 1 and 2, they're in pre-contemplation, they're not ready, they're in denial. 3, 4, and 5, maybe that ambivalence. I don't know. I know I need to, but I'm not sure. 6, 7, 8, we're preparing, we're ready. Trying is get that action within 9 and 10. So that's another way to look at that in terms of you moving from both of those models within MI stuff and then Transtheoretical stages of change. Change talk and commitment language. These are just some things that I felt like would be helpful with DARN is the acronym, but within that, you're looking at the desire, ability, and the reasons. And that's going to be more so to like what you want things to achieve, what you want to achieve that change. I really want to lose weight. I wish I could stick to my medication, regimen. And then A is the ability or the perception of the possibility of change. I could quit drinking if I try. I know it's possible to do this. And then the reasons they talk about, if I stop and make this change, I'll be healthier, or I can get that job I want. And then that need is just saying, you know what? There's an urgency. You know, my doctor said to me within the next 6 months, I really need to focus in on this. I really want this to happen. So those are also going to be ways to get change talk going, and checking in with clients and honing in on that commitment to that change. CAT is another acronym within MI, but then again, it's just more so commitment, activation, and taking steps. Making that commitment, the activation, or making the preparation of the small change. Just when I use drug use, but it's like, no more drug. I know I have a problem. I'm gonna, no more I'm dealing with the dealers. I'm not gonna talk to people or hang out with people who, you know, do drugs anymore. And now I've started taking a fitness class and I go to the gym, or maybe I'm seeing a therapist or things like that. So this is another structured way you can evoke change and have these kind of in blank bubbles and offer the client a chance to expand on how they could fit in with those. Planning, and now it's going from the why to what. And then with also like developing a concrete plan, and then also want to be developing those incremental goals. So that's where we look at things like change plan worksheets, things like brief action planning, and SMART goals is something that I know that it's been within, I think, the human services world culture in terms of having SMART goals and being effective with things that are specific, measurable, attainable, and realistic and timely. So this is an example of like a change plan, like worksheet. And this could be reused or, you know, repurposed and things like that. So more so even the change I want to consider is. So at this point, we're being specific about what we're wanting to change. My main goals in making this change are, and that's a way that them to list out like the big goals. And then these are some of the possible obstacles to change and how I could handle them. So what are some of the obstacles? You know, am I having issues with transportation right now? You know, am I without a cell phone right now? You know, am I working on having access to a computer? Or these are some obstacles that are going to be affecting me in terms of maybe what I mentioned earlier. And another one too, it's like how I could respond. You know, that's more so too. It's like, you know, I need to maybe respond positively. I need to think about how I can be proactive. And then the plan to do these things in order to reach my goal is that action. So that point they're being specific. And so that might mean, you know, creating a savings or picking up a part-time job or whatever that looks like for them. And then when. So we need to focus on the measurable nature of it. I see that myself like by the end of the month, or by the end of the year, or within a week, I've at least made effort or headway on this thing that leads to that thing. I think a great one on here, other people could help me in these ways. So actually naming resources of support, because I think oftentimes too, we forget that there are individuals that could be around us to add support. There may be services that are in place that are there to aid. And then also too, how could they help me change? Maybe they're that person who says, hey, weren't you needing to work on this? They can serve it as an accountability person for them. And then how do I know my plan is working? And then, you know, there may be signs that they'll say to themselves, well, I know it's working because I'm doing something a little bit each day towards it. That could be a good barometer. Or what results should I expect going into like, okay, I'm open in this process, but these are some of the expectations I'd have for myself, and that's okay. And it's okay that this changes too. I think this is a good way to get these ideas and thoughts on paper. So we've talked a lot about strategies to incorporate and bring in within MI, and some sayings to have, and, you know, statements and ways to engage in conversations that are non-confrontational, that guide the client and really honor where they're at. But things that counter MI, we should focus on as well, because they may slip through the cracks and kind of move the MI in a totally complete direction that isn't MI. So I thought it was helpful just to include these in brief. Let's see, so readiness for what? Rather than asking, why isn't this person motivated? Ask, what is this person motivated for? And I think that allows for us to really hone in on figuring out like what is driving this person. And within the first statement, it can be kind of like a morally type of judgment, like why isn't this person motivated? They're not doing anything, yada yada yada. But then more so asking, what are they motivated for? A potential pitfall within this is just assuming that you know. Well, I've met with them a few good times and I know what it is. I know what it is. And so, yeah. So the next one are the MI traps. And in brief, these are just going to be falling into that. Let's see, I'll move this down here. The question answer trap, the yes or no, having a lot of closed questions. I'll go in these really brief too, and we'll expand a bit. So intake is a point of entry. We want to, have that, we have short and simple answers, but oftentimes too, a lot of those questions that intake are closed questions. So within that, it really doesn't offer a lot of opportunities for these expansive questions. So I think within that too, just be mindful of that. And ways to incorporate those open-ended we've talked on earlier. The confrontational denial trap is a big one. They'll tell you that they have a serious problem, and then they'll prescribe a particular course of action. But again, too, you don't want to fall into this trap. You want to have reflective listening and having motivational statements rather than you feeling like you've got the right prescription for them and you know how to solve their problem. The expert trap can happen if we've had years in a job, years in a position, like, because I'm the professional, that's why I know. I tell them and they still don't change. That puts a lot of personal responsibility on you for their change. So we want to take that away. It really should be on them. And so just to keep in mind with that, we're not trying to fix the person. We want to elicit for them to have answers and solutions. So that's something to worry about. You don't want to fall into the expert trap. The labeling trap, we want to go avoid labeling, saying things like you're in denial, even though that's a part of that chart. You may not be, it sounds like you not thought about it in that way, or, but in the same time, we want to work to do reflection. Reframing may be helpful. There's the premature focus trap. You want to establish the problem because you see it as the problem and you're like, I know what it is. That can also like invalidate the client's concerns and they may not feel heard since you're prematurely focusing on what you think the big problem is. The blaming trap, whose fault is it that I'm in counseling? That statement could be made, or why am I here? And it's not easy to address. And it sounds like you're worried about who's to blame here as an example of what you can maybe say. You can talk about the courts are in the business of pushing blame and things like that, but there's a no fault policy and you want to figure out what's troubling them. These are just some listing of some roadblocks. I know we're getting a little closer on time, but within that too, just that warning or threatening, definitely not want to do persuading, moralizing, preaching, judging, criticizing, disagreeing or blaming. Giving advice is a hard one, but we want to refrain from that. And the second roadblocks that I realized were more so just agreeing, approving, cheerleading, appraisal, questioning, probing, and then humor to the point where it becomes distracting or changing the subject. So that kind of wraps up the content.